Welcome back. I hope that you all are doing well and that you're having a good day and having a good week and that you're surviving this semester okay. I am going to be doing a lecture on motivational interviewing, also referred to as MI. So I will refer to it as MI, and I'm sure you will hear that abbreviation throughout your practice. So, MI is a well researched intervention for individuals with addiction. It is really important that I note that MI is a technique. It is not an entire therapy. So, it's not like a theoretical orientation. Rather, it's more of an intervention that you would use. And it's usually used at the beginning of addiction treatment. The overall goal of MI is to bring forth the ambivalence, which is a big word in addiction and also any other mental health treatment. So, the goal of which is to bring forth the ambivalence the individual has toward their recovery. While addiction is a brain based disease, it's also serving some kind of psychological function. So, you're going to see ambivalence when you're working with addiction, meaning that they have, on one hand, they feel like they want to let go of the addiction and they're ready for recovery, whereas the other, they're scared and they like the addiction in a sense. So it's kind of one foot in, one foot out. The basic tenets of MI is change. It's a central feature of any therapeutic interaction. And MI specifically is a relationship-centered, client-centered system of change. So client-centered meaning not judgmental, and you are really hearing the client, providing empathy, providing unconditional positive regard. You really want to be a safe place for the client because, if you're passing judgment or are making like passive aggressive remarks, they're getting enough of that in their life, right? Every other person in their life is judging them for their addiction. So you want to be a safe space. You want to be you want to provide them almost with a corrective emotional experience. So MI is also a trans theoretical approach to the change process. So as you should know at this point in the semester, you should be familiar with the stages of change. So we have pre-contemplation, which is the point where they're not even acknowledging that there's a problem behavior or that there needs a change. So someone with gambling addiction isn't even recognizing that they're spending too much time or too much money at the casino. Moving on to contemplation, this is the point where they are acknowledging that there's a problem, but they're not ready or sure that they want to make any type of change. So yeah, maybe I'm spending too much time at the casino. Maybe have spent too much money, but I'm not sure if I'm ready to move beyond that. Then you have preparation, which is determination. So this is where they've acknowledged it and they are actually getting ready to make a change. Then you have action, which this is where the work is. This is where you are doing most of your therapeutic work and where the changing behavior is beginning to take place. And then you have maintenance, which is maintaining the new behavior, so maintaining abstinence. And some might add an additional stage, which is relapse. And that is not necessarily to be negative or to doubt, but it does happen. So it's more just when you add an additional relapse stage, that's saying, okay, we relapsed, I returned to my old behavior and abandoned the new changes. Let's see how I can get back on, the bandwagon. So The definition of change is the act or process or result of altering or modifying, in this case, behavior. And then resistance refers to an interpersonal exchange whereby a client appears to be working against change while a counselor may seem to be arguing for change. So this is where you'll see, as a therapist, you obviously know, what's best for them. You know what you want them to do. You know what their family wants and their loved ones wants, and maybe they want deep down, but they're making every excuse not to change. So what MI does is it encourages counselors to approach the resistance with a welcoming hand. So it's like, okay, instead of arguing with you, we're going to look at that resistance. So we want to look at what life would look like without addiction. And a lot of times these people, you'll see them go into the loss or the pain, which is a very scary thought. Because addiction is clearly serving them a purpose, right? It's doing something for them. Other than making them feel good, it's doing something. And you want to look at their values. So in MI, you want to look at what they love. So if someone says, okay, I love my wife. One of my biggest values is relationships and love in my marriage, and I love my wife. But every night I'm in the bar. So, you kind of bring out that contradiction. Okay, I'm hearing you say that you love your wife, but I'm also saying that you're in the bar every night and come home intoxicated, so you're not spending time with your wife. Can you help me make sense of that? So what will they lose if they let go of the addiction? So it kind of brings up the contradiction as you word it that way. So this is you have to be careful with your language in MI, because as you word it that way, you want to bring up the contradiction in a way that they probably haven't thought about yet. You help the individual see the conflict. So part of you wants to give it up, but part of you is invested and is scared to let go. Okay, that makes sense to me. Which one would help you reach your long-term goal? And then they kind of think about it, and then they realize, okay, yeah, no, this isn't helping me achieve my values or goals. Then why do I keep doing it? Well, what do you like about shooting up? Okay, so what do you like about shooting up? And then they'll start to give you the positive, which is where the ambivalence lies. So that is the piece that's really critical in this intervention. It is primarily used as a communication style that helps to facilitate change when clients are ambivalent about changing their behaviors. So that's what I was speaking to when I talked about you have to be careful with your language. You use a language in a way to help clients look at their own behaviors a little bit differently than they ever have. So you're asking questions that start to break up how they're conceptualizing the problem. So tell me how you love your wife and tell me how the bar is meeting your needs. So you kind of, like I said, it's that those opposite ends of the spectrum. You're really highlighting that contradiction. And you're not judging it though. You're just simply asking, help me make sense of that. Let's explore that together. I'm here with you. Clients whose counselors use MI are more likely to engage in change talk, and commitment talk throughout the therapeutic process, which is predictive of better treatment outcomes. So again, focusing on your language. You are wanting to promote change talk. And again, that's not going to start right away though. That's going to start once you are moving past the ambivalence. The primary principles is expressing empathy, like I said. So really refraining from judgment and really, really just maintaining a warm presence, providing empathy and expressing an understanding and just really providing that validation. So you're really going back to person-centered therapy here. And that is Rogerian, which I'm not sure if you guys have had your theories class yet, but that's always a good place to start with clients is person-centered. Then you want to develop discrepancy, like I said, so that contradiction. So I'm hearing you say this, but then you're doing this. Help me make sense of that. So you really want to highlight, again, the contradiction. You're going to roll with resistance. So they're going to stick up for the addiction, and that's fine, because obviously the addiction's doing something. They're not just doing it to ruin their lives. They're getting something out of it. So you're just going to roll with that and explore it together. And you're going to support self-efficacy too. So you're going to really promote their autonomy. Techniques that come up with MI is using open-ended questions. So refraining, staying away from yes or no questions instead of like, so how many times a night are you in the bar? 5. Instead of saying that, saying, so what does a typical day look like for you? So kind of staying away from close-ended questions to promote active dialogue. You're going to use reflective listening, which is just reflective language, meaning that you're summarizing what you hear back in your own words. And if you miss it, that's okay. So sometimes, still even now, I'll have clients and I'll say, I'm hearing you say this. And they'll say, well, actually, no, I meant this. Thank you so much for correcting me. So what you're saying is, okay, that makes sense to me. Clients will appreciate that. So you don't want to feel embarrassed, or you don't want to get defensive if you miss something, or because they'll appreciate that that just kind of conveys that you're really trying to understand accurately. Providing affirmations, so really positive self-talk, summarizing and eliciting change talk throughout your dialogue. So as a therapist using MI, you end up facing cognitive dissonance. And that's a big term in this form of intervention. Cognitive dissonance is the challenge of holding two opposing experiences, feelings, or viewpoints at the same time. So I kind of feel one way about this, but at the same time, I feel this way. So this is uncomfortable for someone. We don't like this feeling. We like it just one way or another. So it's kind of like the love-hate in a relationship. Like, I love my partner, but I hate him. I love him, I hate him. It's uncomfortable. But you want dissonance to come up in therapy, because without it, they won't want to change. So the discomfort, although it doesn't feel good, it's good because it moves them towards change. If they have an addiction, the brain is now, firing and wired in a different direction. So they're going to be used to following a certain pathway. So they equate the link between the emotional center, which is the amygdala, and the memory center, which we know is the hippocampus. And they're very closely related and positioned in the brain. So that means often our feelings and memories become consolidated. So I have a feeling and I remember it. That's exactly what happens in addiction, right? Addiction produces a positive feeling. So people aren't addicted to anything that feels bad, right? So we are trying to get our clients to think differently. So if someone has been addicted for 13 years, that's all they know, right? They only know the addiction. And as a therapist, we say, what would it be like to not go to the casino? What would you do instead? That is a big and scary question, but it's good to ask, because then they begin, thinking in a different direction and formulating a different type of plan. So you can use some paradoxical language here. You could say something like, okay, so instead of going to the casino, you would just, go home and watch TV. Yeah, that sounds kind of boring. Not that much fun, huh? And usually, if they're deeper into their ambivalence and deeper into the stages of change, they'll refute that and they'll say, well, it's certainly better than losing my money. And they'll actually stick up for recovery. And that's a good sign. So the roles of resistance, so that's why I said dissonance. meaning you want them to feel that uncomfortable contradiction and kind of want them to be confused and spend some time there, explore it with them. Consonance, which means agreement, and resistance. So resistance in MI, what it looks like is arguing with you, interrupting you, negating, and ignoring you. Those are all signs of resistance. To reduce resistance, you want to maximize their change talk. So examine the disadvantages and advantages. Again, what would happen if you continue to do this? What would happen with your wife? What would happen with the relationship with your kids? What would happen to your finances? What would happen with your job? All these questions to really highlight the consequences that are going to come about the longer they use. And you want to reduce the resistance talk. So you want to decrease the client's comfort with the status quo. So you want to, they're comfortable in their routine and they might not know who they are without the addiction, but you want to bring to light the negatives it's bringing. The questions in MI are calculated in a way to create that cognitive dissonance and discomfort to actively move clients into a new way of thinking into their situation, which hopefully leaves them to make some type of decision to change. Again, you want to use reflection, shift focus, and reframing, meaning like if they say, well, if I let go of my addiction, then I'll be all alone. Okay, so sounds like you feel like, or, you have a fear that, once you become sober, you'll feel really lonely. Yeah, exactly. Well, while that might be true, you want to validate them. That makes sense to me. There are opportunities. Can you see yourself? I'm wondering if you could see yourself meeting someone, since you're not going to be spending so much time at the casino anymore. Can you see yourself moving to a place where you'd be ready to meet new people in a different type of environment and maybe a more healthy environment? So you're kind of reframing that into an opportunity for a positive outcome. So guiding the change process, enhancing confidence. So you really want to boost their self-esteem. Confidence boosting strategies may include reviewing past successes, examining personal strengths and supports, and or creating hypothetical change. So this is really kind of like a solution-focused stance here. Again, I don't know how where you are at as far as learning about theories, but solution focus really focuses on like exception questions, meaning like a time when they were successful. Well, so if someone's really negative and kind of down on themselves, saying, well, every time I do that, I always fail. Tell me about a time when you succeeded. Has there been a time when you succeeded? Well, yeah, one time when this happened. What was different? Tell me about that. So that kind of instills hope that, hey, I can do that. And you want to really build on their strengths and support. So while they might be weaker in one area, they're strong in another area, and you just want to build on that. Strengthening commitment. Strengthening commitment involves the counselors actively reiterating and highlighting what a client has accomplished since beginning the change process. So no matter how slow someone goes, you want to, even a little progress is progress. So you always want to meet clients where they're at, move at their pace, and highlight their little inkling. Even if it's just an inkling of growth, you want to highlight that. So today, you're feeling discouraged today, and let's take a minute and kind of reflect back on our journey. Who were you when you first came in? What's changed since you started coming to see me? And usually they could find something that has changed, and they can see some growth, and that will automatically provide them with hope and motivation to continue to do the work. So MI comes with a lot of success and a lot of advantages. The clients on their own discover reasons for change. So usually when someone comes in, it's because a loved one is making them. Maybe they gave them an ultimatum, or they feel like they're being forced to come to treatment. And people are telling them the reasons why they need a change. But in MI, they're coming up with the reasons. It's an impetus to change comes from the client, and it's empirically validated. So it recognizes both the positive and negatives. Most people don't like the negatives that come with the addiction. So eventually they'll move to really see the long-term consequences. The disadvantages of MI is it may not have the same effectiveness with severely mentally ill clients. And that's because MI requires a cognitive ability to use it. It takes a lot for clients to envision, life without their drugs, especially the deeper they're in it, the harder it's going to be. And it may not be sufficient in reaching all of the client's goals. So it's a good starting point. It's a good intervention, but it's certainly not where all the work, the hard work is going to lie, because where the work is going to be, the challenging, getting started is very challenging, but what's really going to be painful is really exploring the root of the issue. A lot of times it's trauma-based. And that's why you want to make sure you're doing it in a controlled environment and providing a safe place. But this is a really good way to start. So, I just want to highlight another thing. And just as a reminder, it's important to remember how hard it is to let go of addiction. Because, let me just give you a kind of a example here. So say walking with a spouse produces 1x of dopamine. Okay, so it's pleasurable and it gives you 1x of dopamine. Having sex, maybe with your spouse, gives you 5x's of dopamine. An addiction gives you about 1,000x's of dopamine. So it's really hard to compete with the sensation in the brain. If you're getting that 1,000 times dopamine, and it's amazing, it's powerful, you feel complete, you feel assertive, you feel like you could overcome anything, maybe like you're invincible. So it's a really big challenge in figuring out how do we create this pleasure with ordinary things. They say that it takes at least a few years for the brain to actually readapt to not having these substances in it, which that's where that's where individuals fall into relapse. And that's why cognitive dissonance is so important, because you want them to act on that discomfort. And there are some useful websites for MI if you're interested in learning more about it. I'd highly recommend it. Here are 3 links, as well as there is a book on Audible that was very useful for me when I was really interested in learning more about MI, because again, it's a good place, not even just with addiction, but other areas of treatment. It's a good place to start with the client and kind of explore where they're at. So just if you're interested, I don't know how many of you listen to Audible, but I'm going to give you the name of the book. And it's called How to Do Motivational Interviewing. It's very short, and it is by Bill Matulich being Matulich, and it's the 2nd edition. Okay, so that is what I wanted to cover in this week's lecture. Feel free to ask questions or provide feedback, comments, and talk about what stood out for you. Maybe this feels really good to you. Maybe you're excited to use this approach, or maybe it doesn't feel right to you at all. Both are okay. I look forward to seeing you guys in the next lecture. Take care.